Hi, I'm Gail Greenberg. I'm a CF mom, and I work at the National Office for the Cystic Fibrosis Foundation. Today I have the privilege of sitting with Dr. Robert Beall, President and CEO of the Foundation. Bob, we are so excited and proud to be celebrating your 30 years with this foundation, and I'd like to ask you a few questions about our past and our future. What are you proudest of in your 30 years with the CF Foundation?
Well, Gail, obviously I always am pleased to see the improvement in life expectancy for individuals with cystic fibrosis. I'm always excited to hear how so many of the young people are going to college, having families, having careers, and things like that. I'm very excited about our pipeline. But you know, one of the things that really has excited me in the foundation is the fact that we've been able to create a collaborative community. This doesn't happen in all diseases. Our scientists, our physicians, our allied health personnel, they're all willing to share ideas. It's so innovative. It's so important. The other thing that I'm very proud about, in addition to this collaborative community, is that we have a community, a board, our scientists and so forth, that are willing to go into areas that there's a lot of unknown. There's a lot of risk. You know, when I think about when we started searching for the CF gene back in about 1986, 87, well, we were trying to do something no one else had ever done. They hadn't isolated genes before. And we had families where they had multiple children with CF collecting blood samples at family picnics. We had all kinds of things going on. We had a good working hypothesis, but we knew we needed the gene. And so we invested in a number of programs, including Lapchi Choi, Jack Reardon, and Francis Collins. And they were breaking frontiers every day because we were talking about chromosome jumping and gene hopping and all that kind of stuff. And it was a new frontier. And we did this. We found the CF gene more than 10 years earlier than the human genome was completed. And what was really nice about it is some of the things we learned from searching for the CF gene were really the foundation for the completion of the human genome. But we took a risk. We also took a risk in our efforts now to see if we can find a small molecule, a small drug, I often call it the blue pill or the white pill, that might be able to improve the CFTR function, might be able to correct the genetic defect. This was actually written up in New Yorker magazine last year. If we are able to do this, and we have every indication that we're on the right pathway, you know, this will be the first time that a small molecule was able to control and correct a genetic disease. This is amazing. And the data that we have with VX-770 and danufasol and so forth really indicate to me we're on the right pathway. But we took a risk. We took a risk with our therapeutics development program. We have taken risk with other companies and so forth to move the pipeline to where it is today with over 30 drugs in clinical trials, and the fact that we have a number of drugs that are directed at treating the basic defect. So we're willing to take risks. The biggest risk for the Cystic Fibrosis Foundation is not to take advantage of an opportunity.
Bob, what are you most excited about when you think about our future?
Well, you know, Gail, I'm obviously really excited about the fact that we have a pipeline of 30 different drugs that I believe are going to impact on the disease. Many of these drugs are going to treat the symptoms of cystic fibrosis. And we know that by treating the symptoms of CF and adding new drugs, we've been able to add increments of a year or so. These, coupled with our tremendous care center network, our committed physicians, our great allied health personnel, are all making a difference. But when I really think about the fact that we have drugs now that are directed toward treating the basic defect, that are in now phase 3 clinical trials, phase 2 clinical trials, I really get excited. Because instead of just adding increments of a year or so every year, maybe we can start to think about adding increments of a decade at a time. And so this excites me. It really excites me because, again, for the first time in the history of this disease, we are treating the basic defect in cystic fibrosis. So the dream that we always had that our children could live normal lives, healthy lives, you know, is becoming a reality more and more every single day.
Well, Bob, on behalf of all of us with the Foundation, families, staff people, everyone around the country, thank you for everything that you've done for taking us where we are today.